complexity around dementia care is that the communication is often with the patient in front of you, and often with an informant, a supportive person. We would not necessarily call them a caregiver at that stage, but and those are your quality measures. So that's different for many clinicians who are very much maybe used to a one-on-one. I know that differs in setting and by culture, but it's helpful to understand that the entire process from that initial suspicion or concern or reporting of symptoms throughout the disease course is really enclosed in one large dialogue. We have new guidelines published the end of 2024 on the detection and evaluation of symptoms most likely due to Alzheimer's disease. And that visual sort of envelops the entire process in this ring of a shared communication and a dialogue in order to make decisions about what types of diagnostic evaluation we would like to pursue, the trade-offs and the risks and benefits of each of the tests, including biomarkers that we've discussed today, what we can reasonably expect from those different levels of evaluation, what we can reasonably expect from different pathways of treatment and supportive care, what their goals are overall for the process. Do they want that very specific gold standard diagnosis, or would they like to understand broadly that there is this syndrome that will progress? And so, and then also, who will we communicate with going forward? So these are things we try to set the stage, ideally, early on, so that that even that in and of itself is a shared decision from the beginning of the process.
And of course, with individuals who are cognitively impaired, it becomes more difficult. That's why you have to involve the family, the caregivers, proxies, informants. So it's more kind of a systems approach that's required compared to other situations in medicine.
This is beautifully stated. I can just say that, even in the setting of an ultimately fatal disease, patients who go on that trip of a lifetime that they've always wanted to take, or they talk to a loved one whom they've been estranged with for 25 years, and yet they have those what matters most moments. They get to see the birth of a great grandchild. All those things are some of the best parts of my practice, and hopefully a lot of clinicians sharing this program will feel the same.